Well, starting tomorrow, St. Louis County will require face masks indoors for everyone over the age of 5. That is regardless of your vaccination status. Missouri's Attorney General says he plans to fight the mandate in court, but it follows a growing trend of local governments bringing back mask mandates as the Delta variant spreads and cases rise across the country. Dr. Amesh Adalja is here. He's a senior scholar at the Johns Hopkins Center for Health Security and an infectious disease specialist. Dr. Adalja, thank you so much. Are mask mandates really effective if the anti-vaxxers most likely won't wear masks? And also, what level of protection will masks provide those of us who are fully vaccinated?
What we're seeing is really a pandemic of the unvaccinated. The data shows that if you're fully vaccinated, the Delta variant doesn't pose much of a risk to you, and those breakthrough infections that are occurring are rare and not likely to be contagious. What we're seeing is the unvaccinated driving this. So I think when you have these mask mandates put into place again, what you're going to see is it's going to be hard to comply with. Not many people are going to wear it, and it's not going to be something that has a major impact because it's the unvaccinated individuals, people who haven't gotten vaccinated, unlikely to wear a mask, that are spreading this. And it's going to be in certain areas where mask use isn't very common to begin with. So I don't think you're going to see much of an impact here. I understand that businesses want to keep people safe, and I think that's fine if private businesses want to institute a mask mandate for customers coming into their stores because they don't want to figure out who's vaccinated, who's not. But I don't think you're going to see a major impact. We have the solution at hand. It's getting vaccine into people's arms. That's how we fix this problem.
Meanwhile, for those of us who are fully vaccinated, do you recommend wearing masks when we're indoors and maybe in tight spaces with a bunch of other people?
If you're a healthy person, it's very unlikely that you're going to have a significant breakthrough infection. If you're somebody that is immunocompromised, maybe you've had a heart transplant, you're on cancer chemotherapy, a bone marrow transplant, then I do think it might be advisable to wear a mask when you're in crowded, congregated indoor places. But for the general healthy person, I don't think the science supports that there's a need to wear the mask there. But again, this is going to be very difficult because it's hard to know who's vaccinated, who's not vaccinated. But in general, if you're fully vaccinated, this pandemic is largely over for you.
If you already have COVID, do you have antibody protections against the Delta variant?
When people recover from COVID, they do develop antibodies, they develop T cells, and reinfections are relatively rare. They do occur. We've seen it with some of the variants, especially the South African beta variant. So you have some immunity. You're probably protected from severe disease if you've recovered. Your antibodies and your T cell immunity are strong, but probably you would do well to get at least one dose of those vaccines that are out there to kind of shore up that immunity that you've already gotten. And I think this is something we want new guidance on. We want to say that someone who's got a positive antibody test from a prior infection probably only needs one dose of the vaccine to be considered fully vaccinated.
Meanwhile, what is the greatest skepticism about the vaccines that you're hearing? And what do you say to those people?
It's not one thing. It's a lot of misinformation that people have kind of swallowed. Some of it might be that they're experimental because it's under an emergency use authorization, which isn't true, and we do need FDA approval really quickly, and it should be coming imminently, hopefully. Some people have come up with these ideas about fertility, which are really just arbitrary notions that somebody put on social media and they took off. There may be talk about microchips and 5G networks activating them, which is completely kind of ludicrous. But it's really lots of different questions that you hear. It's not one thing. And what you really have to do is talk to people on a one-on-one basis. Usually somebody that's trusted, like a primary care physician, that they do a really good job of trying to really address what concerns there are. There's so much data on the vaccines. You can see with your own eyes how effective they've been and how safe they are. So I think this is something that we can do, but it has to be done on a one-on-one basis now because we've got people that have questions and we're kind of hit a wall with this, with kind of proselytizing the vaccine on television or wherever it might be. Now it's really kind of a grassroots ground game that's going to get more vaccine into people's arms.
Indeed. What percentage of the unvaccinated would need to get the shots in order to arrest this coronavirus and stop the spread of variants like Delta and Lambda that's on deck?
It's unclear because what we're going to come to is a situation where we're always going to have cases of COVID-19. This isn't a disease that can be eliminated or eradicated. What we're trying to do is tame it, reduce its ability to cause severe deaths, severe cases, hospitalizations, and deaths at the rate that it could before. So it can't threaten hospital capacity. So what we're really trying to do is get high-risk individuals of whatever age fully vaccinated so cases decouple from hospitalization. So what we need to do is get more vaccine into people who are at high risk for hospitalization, even if they don't think they are, because maybe they're not 65, but maybe they're 45 and obese, or have diabetes or have asthma. Those are the people we really need to get vaccine into, so you don't see what's happening in Missouri happen in other parts of the country.
I've got about another minute with you, if I can squeeze in 2 questions here. You've got parents who are going to be sending their children off to college or taking, the kids to elementary schools or high schools. What's your advice to those parents on masks and vaccines for those who are over 12 years old?
I would recommend that parents take advantage of the vaccines and get their children fully vaccinated. I think this is a safe and effective vaccine in children. The side effects are still outweighed by the benefit, especially when you have a more contagious variant, when cases are up. This is one way to protect your children, not just because they may not get serious disease, but it's not something that they want to get to begin with, because it's going to be disruptive. It's not good to have COVID. They might be able to spread it. So I advise parents to get their children fully vaccinated. We've got really safe and effective vaccines. We know they work really well in children, and I think that's the best way to keep children safe and to keep school at the university and at the elementary and high school level basically undisruptive, or as disrupted as little as possible in the pandemic.
And if you can give me 20 seconds on this, people are traveling. If you're fully vaccinated, should you feel safe to jump on planes and travel in the States or out of the country?
If you're fully vaccinated, I think it's perfectly safe to travel. If you're immunosuppressed, just remember your vaccine might not be as protective as it could be. So I think this is something that people can do very safely. We need to get away from testing people when they travel. If they're fully vaccinated and don't have symptoms, that's causing a lot of concern with these breakthrough infections that really aren't breakthrough disease. We've got to get our testing protocols in line to make travel easier, though.
Okay, Dr. Amesh Adalja, thank you very much. Take care. Be safe.